Good morning. This is Dr. McDaniel at GYN Corner. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. And let's see, today I decided to speak about something that's something I haven't actually said in a long time. It's a new contraceptive option. I decided to speak about Phexxi. It's a contraceptive gel. Now, it's not a spermicide. Spermicides, as the name implies by the words, the ending of it called side, C-I-D-E, it attempts to kill the sperm with chemicals to destroy it and to kill it. And in fact, or in reality, spermicides are not a very effective contraception by themselves. The failure rate for spermicides is between 18 and 28%. So that means over the course of a year, if you have 100 women who are using spermicide, then 18 to 28 of them will get pregnant. The Phexxi gel is not a spermicide. It is a naturally based or a non-hormonal, non-chemical gel that you place before intercourse, and it maintains an acidic environment in the vagina, and that prohibits the sperm from being viable and able to swim up to the cervix and to the uterus to potentially fertilize an egg. So it acts to maintain what could be considered a hostile or a non-friendly environment for the sperm, because the vagina should be acidic. It should have a pH of 3.5 to 4.5, so very acidic, whereas the semen has a high pH. It's alkaline. It should be over 7.0, around 7.2. So when ejaculate, which the semen containing the sperm, enters the vaginal environment, that surrounding or supportive semen helps to maintain, or tries to, maintain or provide an alkaline environment to maintain the activity of the sperm. And what the Phexxi gel does is it attempts to override the effects of the semen and to keep that vaginal pH low, which is where the vagina likes to be. And because of that, it does not provide the amenable environment for the sperm to stay active and to swim. Now, as I said, it's non-chemical, it's non-hormonal, and it's just used before intercourse. Ideally, it should be used directly before intercourse, so a couple of minutes, or at the outside, 1 hour. It maintains that acidic environment for approximately an hour after it's been placed in, 2 hours after it's been used. So if you place it within the hour before intercourse, you'll have at least a solid hour that it maintains that acidic environment. The failure rate for the Phexxi is approximately 14% or less. So 14% at the worst, and about 7% when it's used appropriately. So the efficacy or the failure rate of the Phexxi gel is equal to the failure rate of birth control pills. But of course, you don't have to do anything on a daily basis. It's what we call an on-demand. So you just use it when you're going to have sexual activity. Now, the what I would say is an off-product benefit, or a non-FDA, non-labeled benefit, is I see a lot of patients who get vaginal imbalances, pH imbalances, vaginal bacterial imbalance, or overgrowth, or infections, or BV after sexual activity with certain partners. So if they use the Phexxi gel, that should conceivably decrease the possibility or the propensity or the risk of their getting those pH imbalances, because that gel maintains the normal acidic environment for them. So that's really a side benefit that is really, really helpful for a lot of women who are just plagued with bacterial overgrowth and issues after sexual activity when they're not using condoms. Now, the Phexxi gel is really easy to use. It's a really skinny tube. It's smaller than a ink pen, or about the size of a pencil, I suppose, and you just squirt it in before intercourse. If you have intercourse more than once, you're supposed to squirt another tube of gel in because it's only good for one sexual act, and the side effects are really minimal. I'm going to say they're actually probably not really related to the gel, except for the fact that some male partners may have a little bit of irritation because of it maintaining the acidity. So they might have a little bit of discomfort or irritation or itching or slight burning. The side effects, according to the research, is less than 2%, so only two people out of 100 will have issues. And the other side effects are really just side effects that are related to sexual activity for women of itself, or if they use any kind of lubricant. That increased lubrication, increased friction can cause slight increased risk of bladder infections or bacteria in the bladder, and yeast infections or irritation from yeast issues after sexual activity. But that's really, I believe, more of a reflection of small bit of yeast that's present already, and then with sexual activity and with that gel acting as a lubricant, it mobilizes that yeast, so it really just magnifies something that was already present. So I hope that's helpful information on the contraceptive gel, Phexxi. It just came out last fall. And thank you for watching. If you like the content for GYN Corner, hit the like, subscribe, and follow buttons. Please also check us out on not just on the Facebook, but we have Facebook, we have YouTube, and we have the podcast. We're on all of the platforms for podcasts. Wherever you like to listen to podcasts, GYN Corner is there. Have a great rest of your day. Bye.